my name is Faith Boyce and I'm a nursing student at HAC, and today I have the physical assessment for George Burney. And the abnormal things I find based on the available information about this patient is that he has chronic obstructive pulmonary disease and he had acute respiratory failure secondary to that. Also, he uses oxygen at 2 liters a minute, but he has shortness of breath. He has a chronic cough, and that's abnormal findings, and he doesn't have energy, and he also has difficulty coughing. So, the questions I'm going to ask him, I'm going to do an old Cart's eyes history on his cough, and I'm also going to ask him some general questions about lung health, and just to get a little history of what I'm working with. And I'm also going to do the lung assessment on him. Oh, here's yours. This one is yours. This one is one of yours. This is the other one of hers. Okay, so here I go. Hi, my name is Faith Boyce, and I'm a student nurse at HAC. Could you please tell me your name and date of birth?
I am George Burney, and I was born on September 23rd, 1958.
Okay. Nice to meet you, George Burney. So, I hear that you've been having some trouble breathing.
That's true.
Okay, well, I am going to ask you some questions and get a little bit of a history about what you're dealing with, and I'm also going to do a little assessment on your lungs. Is that all right?
That sounds good.
Okay. Well, I've washed my hands and I'm all ready to do my assessment. So, just a few questions before I start, just to get an overview of your lung health. How many pillows do you sleep with at night?
Oh, I usually use 2.
Okay. And have you had lung problems? Like, have you had other lung problems besides what you're dealing with now, like asthma, anything?
I had asthma. I've had some asthma all my life. As a child, more severe.
Okay. And does any of your family have any conditions, lung cancer, lung COPD, anything, asthma that you know of?
No, not that I know of.
Okay. And do you smoke?
I do.
Okay. And do you take any medications related to your lungs?
I take steroids.
Okay.
And I have some inhalers from the doctor that I use.
Okay. And yeah, I just wanted to check.
And some oxygen when I need it.
Yeah.
I need oxygen when I exercise or whatever.
That's good. Okay, well, I'll do a little bit of a history on your cough. So why don't you tell me some things about your cough? When did your cough start?
Oh my. I suppose when I was a child I didn't have it, but I've had this cough for a long time. I can't really remember when I didn't have it, but it has been worse the last week or 2.
Where do you notice it hurting? Where's the pressure in your lungs, or how does it hurt?
Well, it feels tight. I just had this tight feeling in my lungs, and it's trouble moving air in and out.
Mm-hmm.
I'd say exhaling's worse than inhaling.
Okay.
Or another thing, if I try to exercise, I mean, right now I can't do much, but before this even, if I try to exercise, and it definitely compounds it, or having a cigarette, or my wife gets to cleaning and stirs up some dust, then I have trouble too.
Sorry. And can you tell me, like, how long, the duration? When does it bother you? How long does it bother you?
You mean like when I start coughing, how long do I cough? Or what are you asking?
I'm asking for the duration of it.
Let's see. Well, it's about all the time.
Okay.
Yeah.
Yeah, that's
And
true.
I hardly have any breaks. It just keeps catching me in there.
Okay, what are the characteristics? How does it...
Oh, it's just tight. I try to get air in and out, and then it catches, and I cough, and I try to cough, but it doesn't. I can't cough much out, and I don't have much energy to make
Yeah.
to work to try harder to get stuff out.
Yeah, that's hard. And how about, does anything aggravate it or alleviate it? Anything make it better or worse?
Using my oxygen and my inhalers definitely helps. But you know, I'd like to be free of that oxygen, so I try sometimes without it, but it doesn't work too well. What makes it worse? Well, like I said, I know I should quit the smoking, but having the cigarette stirs it up, or trying to do too much. Sometimes dust aggravates it.
Okay. And how about, have you been doing anything to treat it?
Yeah, I do have that prescription for the steroids and my inhalers, and then the doctor had told me to do oxygen at 2 liters a minute when I'm exercising or if I feel like I can't breathe. So that's what I've been doing.
Okay, on a scale of 1 to 10, how severe would you rate your cough?
Well, today probably about a 5.
Okay.
Been worse in the last week, but right now it's probably about a 5. I was feeling better this morning.
What impact does this have on your daily activities?
Well, I just do what's most important and let the rest go. I rest a lot.
Mm-hmm.
This morning I went out and walked on the patio a couple minutes, but I can't do what I used to do.
Yeah. And how are you coping with this?
Well, I try to be tuned in to what makes it worse. So when there's a lot of pollen outside or high humidity, I don't go out. I just try to keep looking on the positive side and keep going one day at a time.
And how is this, how are you coping with it?
Well, I get down. Thinking about living like this the rest of my life and there's no cure, it gets me down, but I try to do what I need to do and keep going.
And how does it make you feel emotionally?
Oh, that's it. I'm just down, sometimes I'm down, but then sometimes then there's things that cheer me up and I try to keep going.
Okay, that's you're on the right track. Just try to keep going. So now that I'm done doing a little bit of the history, I'm planning to just inspect your chest and lung area, and then I will do some percussion and some auscultation. So, would you like to take your shirt off for this?
I'd probably rather not.
Okay. All right, so first of all, I'm just going to inspect. I'm going to inspect your posture. Notice how you're breathing. I'm going to notice the depth and the respiratory rate, the shallowness, the speed, breath equal, not equal. And I'm going to notice your color for oxygen. I see your fingers. Yeah. And I'm going to, can I peek inside your mouth and check the oral mucosa? She's getting oxygen. Okay, now do you mind if I test your lungs for equal rise? So I just want you to take a deep breath. I'm going to get a hold of you right here. Okay, take a deep breath. Very nice. Okay, now I'm going to percuss. Between the ribs. Do you mind lifting up this breast for me a little bit? There. Now I'm going to get the other side. All right. Now I'm going to turn you around, and I'm going to, it's fine, you're right, good right there. I'm going to percuss the back side. to get down underneath the clavicle here. All right. Now the next thing I'm going to do is I'm going to auscultate your lungs and just listen for the breath sounds. So the first thing I'm going to do is I'm going to be auscultating your trachea and your brachia, your bronchial tubes, and then after that I'll auscultate the lungs. Okay, so every time I listen, I just want you to take a deep breath, breathe in and out, and if you start feeling like you're getting lightheaded or dizzy, just let me know and we'll slow down. Yeah, same. Let me make sure I have it on the diaphragm. Yep. Okay, now I'm going to start auscultating the lungs. Okay, now I'm going to listen to this one. I'm listening to the other one. Okay, sounds good. All right, yes, this is good. Now I need to listen to your back. So I'm going to start again by listening to for the bronchial sounds. All right, now I'm going to listen to your lungs. Now please cross your arms to spread the clavicles a little bit. Spread the shoulder blades, scapulas. There, now we're almost to the end of the scapula. So I'm going to go out further to the sides. Can you scoot forward on your chair so that she can see, yeah, there, that way she can see what I'm doing a little bit easier. Okay, so now I've gotten down to here. And now I'm going to the side. All right, one more time. Okay, very good. Thank you, Mr. George. So I believe I'm done with your lung assessment, and I hope we find out some things that can help with this cough. And yes, have a good day.
Thank you. You did a good job.